If you are a man over 65 years old and you feel that there are aspects of your health that you have never dared to address, I ask that you pay attention, because what I am about to share today could completely transform the way you see well-being at this stage of your life. Just 2 weeks ago, Mr. William came to my office. After pacing nervously in the waiting room for almost half an hour, he finally sat in front of me and, with a trembling voice, said, "Doctor, I am 72 years old and there is something I need to ask you, but I am very embarrassed." When he finally gathered the courage and asked me the question, I realized that this information needed to reach more people like you. I am the doctor, and after 10 years of attending to men in their golden years, I have heard this same question whispered shyly hundreds of times. Today, that silence is broken. Mr. Williams' question was simple, but profound. "Doctor, at my age, is it still normal that, well, I have intimate moments with myself, and that is the problem. We have built a culture where talking about masturbation after 65 years old is almost a taboo, but allow me to tell you something that will surprise you. Not only is it normal, but modern science shows us that it can be one of the most powerful tools to preserve your health. Yes, just as you hear it, that practice that nobody talks about could be protecting you from prostate cancer, improving your heart, and strengthening your mind. But here comes the most crucial part. While Mr. William looked at me with those eyes full of doubt, I knew I had to explain everything. The benefits, yes, but also the risks, because in medicine nothing is completely black or white. There is a spectrum of gray that you need to understand thoroughly. You see, when we talk about male sexual health after 65 years old, we are talking about much more than pleasure. We are talking about surviving with quality of life, and this brings me to the essential point. Imagine your body as a wonderful machine that has been running for more than 6 decades. Like any machine, it needs maintenance, and one of the most important and least mentioned is related to your sexual health. Mr. James, another of my patients, explained it clearly to me. "Doctor, it is like having a classic car," he said. "If you do not start it from time to time, it rusts from the inside," and he was completely right. What I discovered afterwards was even more revealing. At Harvard University, a study followed over 30,000 men for decades, and the results were conclusive. Those who maintained regular sexual activity, including masturbation, had up to 33% less risk of developing prostate cancer. 33%, that is not a minor difference. It is the difference between living with fear or living with confidence. While I was explaining this, Mr. Michael interrupted me. "But doctor, I thought that was bad for the prostate." And there lies the problem. What our grandparents believed, based on religious or cultural myths, modern science has completely disproven. You see, when you ejaculate, your prostate cleans itself. It is like running water through a pipe. If you never use it, sediments accumulate, substances that can become cancerous. Maintaining that regular flow literally means washing your system from the inside. Mr. Robert could not believe it when I showed him the studies. His face changed completely, from shame to relief and then to curiosity. "Doctor, then, what are the specific benefits?" he asked me. And that is exactly the conversation we are going to have now, because there are at least 10 scientifically proven benefits that you need to know. First, and this is fundamental, it improves the nutrition and health of your penis. I know it may sound strange, but think of it like a garden. If you do not water the plants, they wither. Every time you have an erection, oxygen-rich blood floods the internal tissues. The corpora cavernosa fill with nutrients. It is literally a health bath for your most intimate organ. Without this regular irrigation, the tissues become stiff, lose sensitivity, and over time erectile function deteriorates. If this seems revealing to you, wait until you hear what comes next. And by the way, if you know someone who needs to hear this, share this video. It could change their life, just as it changed Mr. Williams. Because the second benefit is even more impactful. It is a direct ally for your prostate. For years, we were told the opposite, right? That masturbation was harmful. Well, science has shown that it is exactly the opposite. That Harvard study I mentioned followed men from age 40 to 80 and found that those who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer. 21 times, that is approximately 5 times per week. And it does not matter if it is with a partner or solo, the protective effect is the same. The theory is simple but powerful. Ejaculation cleans the prostatic ducts, eliminates possible carcinogens, and prevents the accumulation of toxic substances. While sharing this information with Mr. Daniel, he remained thoughtful. Then he said something I will never forget. "Doctor, then all these years of abstinence out of shame could have harmed me?" And the answer is yes. Silence and shame can be more dangerous than any disease. But the important thing is that now you know. Now you can make informed decisions. The third benefit is one that surprises all my patients. It strengthens your pelvic floor. Those muscles that you may not even have known existed are crucial for your quality of life. They support the bladder, the rectum, control urinary continence, and with every orgasm, they contract rhythmically. It is like doing Kegel exercises, but in a natural and pleasurable way. I remember Mr. John, 72 years old. After his prostate surgery, he suffered from post-urination dribbling, those annoying drops that stain underwear. When he began maintaining regular sexual activity combined with specific exercises, the improvement was dramatic. In 2 months, he told me, "Doctor, I no longer need the protective towels." I regained control. And not only that, his confidence returned. He stopped avoiding social outings for fear of accidents. But here comes the most fascinating part. The fourth benefit has to do with your heart and blood pressure. It is a natural stress reliever, and I am not talking about cheap philosophy, but pure biochemistry. When you reach orgasm, your body drastically reduces cortisol levels, the stress hormone that inflames the arteries, raises blood pressure, and keeps the body in constant alert. Mr. Edward explained it perfectly. "Doctor, since my wife passed away 3 years ago, the stress was killing me. I could not sleep, my blood pressure was through the roof, medications helped, but it was not enough." When he finally overcame the shame and resumed his sexual life, including intimate moments with himself, the changes were remarkable. His blood pressure dropped, he began sleeping better, and he told me something beautiful. "I feel that I am honoring my wife's memory by taking care of my health." It is not only about sex. It was never only about sex. It is about comprehensive health, quality of life, and dignity in aging. This brings us to the fifth benefit, which is absolutely wonderful. Your brain becomes a natural pharmacy. With every orgasm, a cocktail of substances is released that no laboratory can match. Dopamine, the molecule of pleasure and motivation. Oxytocin, the hug hormone that makes us feel connected and at peace. Endorphins, natural painkillers more powerful than morphine. Serotonin, the antidepressant your body produces for free. All of this floods your brain, creating a profound sense of well-being. Mr. Henry told me, "Doctor, it's better than any depression pill." And he was right. Now let me tell you something you may never have considered. The sixth benefit is a preventative tool that could save your life. Regular masturbation is a form of medical self-examination. Every time you touch yourself, you are doing a checkup. How is the sensitivity? Are there any unusual lumps in the testicles? Do you feel pain during an erection? Do you notice changes in shape or texture? 6 months ago, Mr. Samuel detected a small lump in his right testicle. During one of these intimate moments, he immediately came to the clinic. It was a tumor at a very early stage. We operated in time, and today he is completely healthy. He told me, "Doctor, if I had continued with shame about touching myself, I might not be here to tell the story." And it's true. Knowing your own body can be the difference between life and death. The seventh benefit is one that all my older patients particularly appreciate. It promotes more restful sleep. If you are like most men your age, insomnia is probably a frequent visitor. You go to bed tired, but your mind does not stop. You toss and turn, get up to the bathroom 3 times, and the next day you're exhausted. Here is a natural and pleasurable solution. Orgasm releases prolactin, the hormone that induces deep sleep and at the same time reduces cortisol, allowing your mind to relax. It's like flipping a switch on your worries. Mr. Albert described it perfectly. "Doctor, it's my natural sleeping pill. 15 minutes later, I'm deeply asleep and I sleep through the night." But wait, it gets even better. The eighth benefit has to do with something we lose with age: connection with our own body. As we age, we start seeing our body as an enemy, a source of pain, limitations, and frustrations. Conscious masturbation is a way to make peace with that body. It is an act of self-love, acceptance, a celebration that after so many years, it is still capable of giving you pleasure. Mr. Joseph, 78 years old, expressed it to me with tears in his eyes. "Doctor, for the first time in years, I don't hate my body. I learned to love it with its wrinkles, its gray hair, and its limitations. It is still my faithful companion." And this brings us to the ninth benefit, especially important for those who have a partner. It helps understand and control your sexual responses. Many men suffer from premature or delayed ejaculation without knowing why. Masturbation provides a private laboratory to experiment, learn your rhythm, discover what stimulates you, and practice control techniques. Mr. Ronald had this problem after years of marriage. The frustration was affecting his relationship. When he started practicing the stop and go technique alone, he learned to recognize his signals and control his response. His wife called me to thank me. "Doctor, you saved our marriage," she said. And it wasn't me. It was Mr. Ronald who had the courage to work on himself. The 10th benefit is perhaps the deepest. It keeps the pathways of desire alive. Remember, your brain, not your penis, is your most important sexual organ. Desire is born in the mind, in memories, fantasies, and neural connections. If you stop using these circuits, they atrophy. It's like a path in the woods. If no one walks it, weeds cover it. But when you maintain regular sexual activity, including masturbation, you keep that path clear. Neurons continue connecting, and libido remains active. Mr. Gustav explained it beautifully. "Doctor, at 75 years old, I still feel that inner fire. Not as strong as at 20, but it's there, warm, reminding me that I am alive." Everything I have told you is backed by decades of research, thousands of studies, and millions of men who have experienced these benefits firsthand. But as your doctor, I must be completely transparent. None of this replaces your regular medical checkups. If you are over 50, the PSA test is mandatory. Early detection saves lives. Mr. Henry, the patient I mentioned at the beginning, left my office as a new man, not because I prescribed expensive medications, but because I gave him permission to be human, to take care of himself without shame. To understand that pleasure and health go hand in hand, especially at this stage of life. But, and this is a very important but, just as there are wonderful benefits, there are also risks you need to know. Incorrect ways of doing things that can cause harm, addictions that can develop, warning signs you must not ignore. That's why I prepared a complimentary video where I explain the 10 most common errors and risks. Believe me, ignoring these risks could turn something beneficial into something harmful. I have seen cases of men who, due to lack of information, hurt themselves, developed dependencies, or ignored important symptoms thinking they were normal. You deserve to have all the information, the benefits and the risks, the bright side, and the necessary precautions. Look at Mr. Charles now, at 74 years old, sending me photos from his trips with his new partner. Mr. Michael regained that spark in his eyes that his family missed. Mr. Robert controls his blood pressure and sleeps like a baby. Mr. Samuel is alive thanks to that early detection. All of them have something in common. They decided to leave shame behind. They decided that their health was more important than taboos. And you, what are you going to decide? Will you continue carrying decades of myths and shame, or will you embrace modern science? Will you keep whispering questions in fear, or will you take control of your sexual health? The decision is yours, but let me tell you something. Your body is waiting. It has been your faithful companion for more than 6 decades. It deserves to be cared for, to be known, to be celebrated. This knowledge I share today could be the most valuable gift you give yourself, the key to healthier, fuller, happier golden years. But remember, knowledge without action is just entertainment. Take what you learned today and use it. Talk to your doctor if you have doubts. Explore your body without guilt, and above all, don't forget to watch the video about the risks, because taking care of yourself properly means knowing the full picture. It has been an honor to have this honest conversation with you, because your health, your well-being, your happiness in these golden years, that truly matters. It matters a lot, and you deserve to live them fully, without shame, with information, and above all, with the dignity you have earned over a lifetime. I'll see you in our next video.